Okay, welcome to week 2, everybody. This is lesson 2. History of health informatics is going to be our focus for this session. The reason we're doing this is because in the course description we have the topics will include the history of information technology in healthcare settings. So we're going to go from here to the outline is going to be terminology. We're going to look at a few words. Then we'll start looking at the history. Then we'll go ahead and give you the study questions and next steps. It's going to be similar to last time, except this should be a little bit shorter than previous versions. So hopefully you'll get enough out of it to do well on the quiz. All right. So one of the things that you might see in the field, and maybe you're asking these questions now, is that health informatics, is that different than healthcare informatics? Is it different than healthcare business informatics? Is it healthcare informatics or healthcare as one word? Is it health information management? What's the difference between health information management and health information technology? All these terms kind of fall in the same realm. One of the things that I like to tell students is that if you're looking at healthcare as two words versus healthcare as one word, a lot of times healthcare as one word is used sort of as an adjective or to represent the healthcare sector. And healthcare as two words is more like health care, like as in you're getting care. You'll see this interchangeably depending on the resource that you use. Some of them use it consistent, but most you're going to get different viewpoints from different resources. So let's move right along. So I thought I'd go to Wikipedia, which I know all of you are very familiar with. So it's our one source of information that is most reliable, right? So health informatics, also called healthcare informatics, medical informatics, nursing informatics, it's all the same stuff. And it's in the field where it uses information technology, health information technology. So when you think of healthcare informatics, just think that it's a piece of healthcare information, a part of healthcare information technology. So let's move right along. So the National Library of Medicine defines health informatics as the interdisciplinary study of the design, development, adoption, application of IT-based innovations. It's basically what we just said. Deals with the resources, devices, and methods required to optimize acquisition, storage, retrieval, and use of information in health and biomedicine. So health informatics is just a part of health information technology. Okay. What about HIM versus HIT? Now, HIM is Health Information Management. So when you're thinking of HIM, you think of the Medical Records Department of a hospital. And their representative organization is HIMSS, Health Information Management System Society or something like that. Anyway. HIT is Health Information Technology. It's IT in healthcare. So if you're in a hospital setting and they said go over to the HIM department, they would be talking about medical records. But if they said go over to the HIT department, they'd be talking about information technology or informatics. Okay, that's just something to keep in mind. So history. So let's look at the history of this. And I just put this quote from James Baldwin. He's a playwright and literary author. But as he states it, know from whence you came. If you know whence you came, there are absolutely no limitations to where you can go. I think we kind of see that in information technology, especially in healthcare, because we've seen how, if you think back to when you first had a computer and to what we have today, the transition or the evolution of IT altogether is exponential. And so now we're looking at nanotechnologies, faster processors. We're looking beyond terabytes and into petabytes and zettabytes, etc. So we're going very far with it. So let's take a look back. So where does healthcare IT begin? We look back to Germany's Dr. Gustav Wagner, who established the German Society for Medical Documentation. So it didn't really originate in the United States. It actually originated in Germany. So this is the first time that we see information statistics being used for informatics for healthcare purposes back in 1949. So 52, Dr. Arthur Rappaport spoke about using the McBee manual punch card, and you'd have to know something about the first versions of computers to understand that there used to be a practice where they would actually take paper cards and stick them into machines, and the punch would put out a series of openings that could be read by the computer, kind of like the ones and zeros, but they were physically punched into the card. So computers at that time used to read the cards and process information that way. So just imagine what a program might look like with 1,000 punch cards, probably. Let's move on to 1959. We had Ledley and Lusted published their influential paper, Reasoning Foundations of Medical Diagnosis. So at that point, we're starting to really get to use information in a healthcare setting. So it's starting to gain traction in 59. But the field of informatics as we know it emerged when computer technology became sophisticated enough to manage large amounts of data. There were earlier experimentations in the field, but it wasn't until the 60s that health informatics began to standardize as a field of study. So it's in the 60s where we see that things are starting to gain traction. And here was an interesting one about the Utah's Latter-day Saints Hospital, one of the first to use electronic medical record. That was kind of interesting to me because I wasn't aware of that. But 67, you also had Papalardo, Marble, and Greens develop MUMPS, a programming language, which made it easier to create medical databases. So it's the basis of many contemporary healthcare record software today. Maybe we'll get into that a little bit later with MUMPS. But in 1970, we had the release of computerized provider order entry systems, and earlier adopter was El Camino Hospital, California, and they had great success with the software at that time. So in 85, so that's not very long ago, looking at 32 years ago, the first software, Cadence, came out. So that was the first patient scheduling software, Cadence. And in 88, the government starts to use medical records, and they invest money into science applications. International Corporation's Composite Healthcare System for all local and OCONUS military health centers. So throughout all of their military facilities, they started using their own system. So let's move right along from 88. So the thing about medical records is that with health information, none of the health information was ever standardized. There was nothing, systems couldn't talk to one another, and we still see that today, especially between departments. And if you think about it, it kind of makes sense that there's a problem there. Perhaps the greatest irony of the field is that there's no standard when it comes to technology behind the data. So a radiology department and a pharmacy department are going to have two different missions and need two different types of information. The radiology department's not interested in how many units of oxycodone that they have in the hospital, and likewise the pharmacy's not interested in the x-rays of patients on the other side of the hospital. So to get information from one to the other, there really wasn't a method to do it until HL7 came about, and we're going to get to HL7 here in a little bit. So in 1992 we had EpicCare, and this is the Epic system. This Epic system was founded in 79, but really didn't come to market until 92, and it's one of the most commonly selected electronic health records by eligible professionals participating in meaningful use. CMS said that 109,000 attested to meaningful use using Epic, followed by approximately 49,000 from Allscripts. So the others just kind of lag behind. There's Cerners and Allscripts. There's some other ones, but we don't need to go into that in too much detail. But just know that Epic dominates the market, and New Hanover Regional has Epic. They integrated that system over to Pender Memorial, and some of the other hospitals around here use Epic systems. And those that are being taken over by New Hanover are also going to be on the Epic system at some point, because they want to have that integration between them. All right, so let's move along. So in 2004, not to get too political, but we had President Bush and President Obama. This is where the healthcare IT industry really started to gain some traction. And we're going to look at some of the data or some of the initiatives that each of these presidents implemented to actually make IT better for us and for the healthcare industry. So let's look at Bush. President Bush, if you recall, he had a 10-year plan. It called for the completion and adoption of standards that will allow medical information to be stored and shared electronically while assuring privacy and security. Now, here's a link. All you have to do is Google it, but the information that you want is going to come from the White House for President Bush's 10-year plan. We'll go ahead and go there. We'll take a quick look at it. So I know this is pretty small, and we're just going to get to some of the highlight points of it. But the idea is that President Bush had this 10-year plan, this solution, health information technology. So there was an initiative that he kicked off that actually kind of blended or fell over into the Obama administration. And President Obama kind of took the reins for it and promoted it and made it even better. So here we are, the solution. It was a 10-year plan. Okay, one of the notable outcomes of President Bush's 10-year plan, or some of the notable outcomes, were transmitting X-rays over the internet. That's something we take for granted now, but it was a big deal back in the day. Today, a patient's chest X-rays can be sent electronically, and electronic laboratory results, electronic prescriptions. All of these items were not. Think about how it was before the electronic medical record. How did you get a prescription? You know, there was always the handwritten paper prescription. The lab results, you had to actually go get a lab result, have them faxed over, something to that effect. X-rays, you usually had to get those big, bulky X-rays, those plastic things, and take them to your doctor for them to look at. Now you don't have to do that, and part of that is because of President Bush's 10-year plan. So just after that, we had President Obama's HIT initiative. So his health care, everybody's familiar now with the Affordable Care Act and when it came into play. It started actually in 2009, but the Affordable Care Act was passed in 2010. And we have since been implementing all types of healthcare IT initiatives. We're not going to go through all of them, just want to take a quick look at them, a quick list. We have the cybersecurity and internet policy, a modernized patient system, bringing tech from the lab to the market. All of these you can take a look at the Obama White House archives. Same Google type search, just be sure that you click on the whitehouse.gov link. Okay. All right, so we won't go into that too much. Then after that, since that time, many of you know how we started the transition, but in 2012, Massachusetts General Hospital started to do trials that had wearable health monitoring devices, which record the movement, respiratory rate, heart rhythm, and vital signs of expectant mothers during childbirth. And they plan to introduce the system in Uganda to curb infant mortality rates. By 2013, nearly 3/4 of physicians use tablets to maintain electronic medical records. So we've really come a long way in a fairly short amount of time. But that's where we're at for healthcare history, or healthcare informatics history. That's about as much as we need to know. And it's just to give you some background information. So let's go ahead and look at those definitions, because this is going to be for the next quiz. One of the things we want to talk about is HL7, or Health Level 7. When we talk about HL7, it's typically you typically think of it in terms of the standards rather than the actual organization. But Health Level 7 is an organization. It's a brick and mortar type organization. But if you hear HL7 in the field, it's typically going to be about coding. And what it is that standard electronic medical records, the base, and as we were talking about Epic as an example, needs to be able to speak with electronically other types of systems, like those in ER or those in finance or in the lab. And what you'll see in a hospital setting is that those labs and ERs oftentimes have a different kind of software that is more often more effective than modules set out by the base vendor. For example, the Epic EMR system, they have modules that they can tack onto their electronic medical record system for the emergency room and for the lab and for radiology, etc. But other vendors out there often have better products. Maybe it has some functionality in their software that they've developed that is specific to those particular departments. Now, if the hospital purchases that other software, the base system may not be able to speak with it directly. So the Epic system might not be able to talk with a Lawson system or some other proprietary type software. But to do that, they would use HL7 interfacing. So this is a component where you put together the program, and you program it to where those two systems will talk with each other. And so HL7, it's a nonprofit organization, but it often refers to standards rather than the organization itself. So what does it look like? We have a picture of it here. This is an example. You're not required to understand this or even be able to interpret it so much, but you just have to know that this is what an HL7 coding looks like. On the left side in that first column, you have the header information. Each one of those 3-digit headers has a meaning for it, and you can kind of see some of the information that is found in this particular transmission. And we're not going to get into the details and intricacies of how HL7 works, but you just need to know that it is a standard for allowing systems to speak with each other. The second definition is going to be FHIR, and that's the way it's pronounced. It's the Fast Healthcare Interoperability Resources Specification. This is essentially the newest version of HL7, and so it's just new, and it's starting to slowly become the standard in the industry. And this is what a FHIR example would look like. And if you've done any coding with like HTML, this would look very familiar to HTML coding, but it's a little easier to follow, kind of makes a little more sense, and maybe a little bit easier to manipulate. So it's just another example of HL7 moving forward into this FHIR. SNOMED. This is a term that you're going to hear in the field just about wherever you're going to be, but the systems nomenclature of medicine clinical terms. And this is a processable collection of medical terminology covering most areas of clinical information. It's a global standard focused on pathology. And this is important because you're going to see a couple of examples where SNOMED is integrated into some of these coding examples. So here's an example of SNOMED. If you look at SNOMED International here, so this is the International SNOMED coding, you can see that there are various number of digits for each of those codes. So you have the 6365 0001 483 4000, and to the left, each of these codes has a descriptor, and it's different than CPT or ICD coding. In that this is a global type of coding system. So this, if you have typhoid fever, there's no difference between what we would use in the United States at 483 4000 than what the UK or Canada or some other nation might use. So it's an international system, which it can be useful. Just know that one. Low NC. This is the logical observation identifiers, names, and codes. These are common language set identifiers for identifying health measurements, observations, and documents. If you think of an observation as a question and the observation result as an answer, low NC could be a part of that. So let's take a look at what a low NC looks like. So this is a good example of showing how low NC is different than SNOMED. And so you can see the descriptors of 1558-6, fasting glucose. When you think of low NC, the way I like to think of it is laboratory results. Okay, so maybe the L connects with laboratory for you, but low NC is typically in a laboratory, but it just describes those procedures and the results of those procedures. SNOMED is just more like a CPT type of code, but it's universal. All right, so the next one, this one kind of gives us a kind of the HL7 that we were talking about earlier. So this gives you an HL7 code with the prefix over here, and then the code identifying this observation, what are the results. So you have low NC, the LN, and the SNOMED, SCT, so it's coding for SNOMED. Again, we're not going to get into it too much detail, but I wanted you to have a visual of what this all looks like. And this is just another part of it. This all comes from the lownc.org website, so they have these examples, and this of course is HL7 that we're looking at. All right, the next one is DICOM. Digital Imaging, Communication, and Medicine. When you think of this one, like low NC, you would think of the laboratory. For DICOM, it is specific to radiology. It's a standard for storing and transmitting medical images, includes file format, definition, and network communication protocol. So it's a protocol, a standard for just transmitting radiology. The last time I had seen DICOM, they were mostly transmitting in PDF format, but digital imaging, communications, and medicine. So there's your five terms. All right, so you have DICOM. Let's go back to the beginning real quick. These terms: HL7, Health Level 7, FHIR, Fast Healthcare Interoperability Resources Specifications, SNOMED, Systemized Nomenclature of Medical Clinical Terms, low NC, and DICOM. Okay, so those are going to be the five. This is an illustration of DICOM, an example of DICOM, and you can kind of see the coding over on the far left here. You can see there's quite a bit of difference between this coding and the other codings that we've looked at. All right, so let's see what's next. Okay, next steps. We have the discussion activity. This week we're just looking at the video. We're watching the video. You're getting your words. We're going to do the discussion activity number 2. Watch for announcements. Study week 1 and week 2 terms. So you'll have 10 terms coming up on the next quiz. I think at least 10 terms. So if we're going into, well, if the quiz is in week 3, we're going to go ahead and have probably a few more than 10. But Monday is Labor Day, so happy Labor Day. Just to keep in mind that the college is going to be closed then, so if you're coming to campus, there's no need because we're going to be closed. Friday the 15th is when we start 12-week sessions, and actually Friday the 15th is the final day to register for 12-week sessions. This was a new thing that the college implemented when we didn't quite get enough people enrolled in certain classes at the beginning of the semester. Delaying those by 4 weeks would allow some students to tack on those classes if they needed them. So if you're still looking for some courses that you want to use to complete your program, see if there are any 12-week sessions available for the course you're looking for. Otherwise, you may want to look at mini sessions. But the last week to register for those 12-week sessions is September 15th. And that's it. If you have any questions, feel free to give me an email. Send me an email. I'm happy to help you out any way I can. And look forward to the next lesson. We'll talk to you later.